English people's rights to services are linked to something called an access program, which is present in every region. And it's the elements that are contained within that program that are going to really dictate the level of service that an English speaker has in the region where they live. Because you do have a right to a service, but the service level may be different depending on where you are in the province. That right is in keeping with the organizational structure and the human resources, material resources, and financial resources that are available at that particular institution. When you're looking at developing an access program, the really important part is to have community input, because when you have an input from the English-speaking community, that's really where you learn where the English-speaking services are the most necessary and where the public health partner needs to focus whatever resources they do have in order to exercise their particular access program to be the most benefit to the English-speaking community in that region. But it's also really important for people to understand that there are elements that are crucial to health and social services that aren't covered under access programs. So things like ambulance services, doctors in clinics or private clinics. Those are instances where English speakers will be looking for health and social services in English, but there's no guarantee that you have the right to those services in those particular instances. When you've got an elderly person who has a language barrier and you have a paramedic who has a language barrier, and you're trying to make sure that the diagnosis is correct so that the person goes into the system, going into the right place and getting the right service, at the right time. And if those elements are not triaged properly from the start, then the person can experience delays in their care. They could have inappropriate care. And it's not something, and I think this is really important for people to understand, it's not an outcome that the individuals working within the healthcare system want to see either. So it's an element of the care process that makes things difficult for both the system, but the community as well. Once there's an understanding of the system in place, it's easier for community members to find their way through it and use instances designed to get their input. Giving your input is the most important thing you can do as a member of any community to make sure that what's really important and what's necessary is taken into account by people making decisions. But if you're a member of the community at large, I would really strongly suggest you look at the users committees in your hospitals, in your region, and get involved in those. Those are really great ways to provide direct input on how people are experiencing care within the system.